welcome to this movement-based class aimed at women who have very recently undergone surgery for breast cancer. I invite you to find a comfortable seated position for these exercises. Bring your feet onto the ground, hip width apart. And become aware of the sensations of the contact of your feet on the ground. And then have a sense of lengthening up through your spines. So I'm placing the heart pillow that the NHS provided underneath my armpit. I'm finding that quite comforting at the moment. So if that's true for you, then feel free to keep that pillow underneath your armpit. Otherwise, you don't need to. It's there as an option. If it's comfortable for you to lightly close your eyes, then do so. Otherwise, you can fix your gaze at a point just slightly ahead of you and down to the ground. And I invite you to turn your attention inwards. Taking this opportunity to simply notice. Notice how you're feeling right now in this very moment. Not how you were feeling yesterday, not how you might be feeling tomorrow, but how are you feeling right now? And whatever is true for you, acknowledging it with compassion, without any judgment. Bringing some kind awareness to the way things are, to the way you're feeling. Knowing that this is part of your healing journey. Tuning into the natural rhythm of your breath. Becoming aware of the movement that is created when you breathe, and that might be very minimal. You might notice more movement. Just noticing what's already there. And if it's comfortable for you to do so, you might like to bring a hand onto your chest. I'd suggest you use the opposite hand to the side you've had surgery on. If you've had surgery on both sides, then see if it feels comfortable for you. And if not, simply rest your hands facing down on your thighs to allow a sense of groundedness. So you could have one hand on your chest, your heart center, one hand on your thigh. Or maybe you like to bring one hand onto your belly and one hand onto your chest. And just see if you can notice any movement under your hands with your breath. And if that's not happening, that's completely fine. Just bringing your awareness to what is at this very moment. Noticing if your breath has begun to slow down as we enter this state of relaxation. And as the breath slows down, it often finds its way slightly deeper into the body. So we're not trying to force anything with the breath. It's soft, it's slow, and it's gradual. I invite you to see if you can notice the breath expanding your belly as you inhale. Maybe the lower part of your rib cage. See if you can notice a 3D nature to your breath. So the breath is impacting the front, the back and the sides of the body. And one way I find it helpful to access the fullness of the breath and all its glory it has to bring to us and our healing journey is to bring my awareness to the centre of my belly or my rib cage and have a sense of breathing from the inside out. So there is a sense of creating internal space with the breath. And see if you can breathe in and out through your nose, nasal breathing. There's an awful lot of health benefits to inhaling and exhaling through your nose. And then bringing a steady rhythm to your breath. So thinking about having the same length inhalation, the same length exhalation. So a ratio that helps to balance the nervous system. You might like to count 4 counts as you breathe in and 4 counts as you breathe out. Setting your own pace that feels manageable for you. And this movement that's created with the breath helps to stimulate our circulatory system as well as our lymphatic system. So in terms of supporting your lymphatic flow after having lymph nodes removed from underneath your armpit, a simple breath practice can be very helpful. So whilst we're in the early stages of healing, knowing that breath alone can be very supportive in aiding healing when it's conscious. Slow, soft, gradual, equal length inhalations and exhalations, finding a sense of expansion on the in-breath, a sense of opening up from the inside out, creating space for the universe to fill with its healing powers. Exhaling and drawing in. So you could think of the in-breath bringing healing energy into the body. And the out-breath letting go of anything that our body no longer requires. So maybe any sense of inflammation, any unwanted emotions, any byproducts from the operation that would be helpful for us to eliminate from our bodies. So really sensing that inhalation bringing in newness, freshness, vitality, healing. And then the out-breath, letting go of anything that our body no longer needs. And then perhaps seeing if you can take a slightly deeper breath on your next inhalation and noticing any sensation that brings to your body. Almost a spreading around the centre of your spine, maybe around the back of the body. You might begin to notice a difference from the side you had your surgery and the side that you didn't if you had surgery on one side. Maybe there's a sense of a mild pull. Just knowing that this subtle movement can help to maintain a range of movement help to maintain a sense of elasticity around the ribs. It can also help to eliminate fluids that aren't no longer needed and bring in the new fluids that are helping to repair and restore. Perhaps just help to reduce the chance of adhesions and excess scar tissue. So there's a lot to be gained from a soft, slow, gradual yet full, deep and expansive inhalation. And then a simple letting go on the exhalation. And taking this moment to thank your body, acknowledging what it's been through. I've had a sense of shock, some trauma. Just acknowledging that and thanking your beautiful body for having the capacity to deal with it, to cope, to adapt. The adaptability of our bodies are amazing. So really sitting with knowledge of how adaptable and accommodating our bodies are. And taking a moment to acknowledge the 15 to 30 trillion cells in our bodies and how all of those cells are playing a part in maintaining our health, supporting our healing, and how they're going to help us move forward with a newness of life, a fresh start. Really fostering a sense of trust in your bodies. Trust to heal, to repair, to minimise the effects, to adapt to the effects. If you're able to do so, simply letting your body know how much you trust it. And sending it some love and compassion. And just knowing that however you're feeling in this very early stage, post-surgery, you can always come back to this breath, this quiet place. And it will be serving you in many ways. Noticing when you take a deeper, fuller breath, how it expands across the back of your rib cage. And I invite you to maybe bring your forearms just slightly ahead of you. See if you can experience the fact that 75% of our lungs are actually posterior. So breathing into the back of the body can really help to access more oxygen and more healing from the breath. So on your next in-breath, see if you can foster a sense of expansion across the back of your bodies, as well as movement at the front. And exhaling and releasing. And again, you might notice on the side you had surgery that there's a mild sense of a pulling as you open. No pain, just a sense of pulling where tissues have been affected. So this breath is helping to keep the elasticity and the expansiveness there. If you feel any pain, then I would reduce the depth of your breath. But it's important this breath is soft and it's subtle. So you're not trying too hard with this. It's coming from a soft, subtle place, deep within. You might feel the belly fall away. So it's that sense of creating internal space. Shoulders are relaxed, there's no tension, my arms and hands are completely soft. You can do this in bed, lying on your sides would be very nice in a fetal kind of position. And from there, slowly rising back up. And lightly close your eyes. I'd like you to hug your elbows into your side, lift your arms up and circle through your wrists. Again, ankles and wrist circles are really good for keeping your circulatory system moving and flowing. So I've been doing those in bed. So there's some movement going through your entire body. You can make a fist and release your fingers. Just pressing the tips of your fingers together. Lots of sensory nerve endings in the fingers, in the hands. Your brain actually perceives your hands to be bigger than they are due to the number of sensory nerves we have in them. So bringing awareness to your hands can really help with a hand-brain connection and to keep the nervous system healthy, especially with lymph node removal. The nervous system has been affected, and there's a lot we can do to support our bodies in adapting to that. Bringing your arms now just to rest gently on your lap. Have a sense of sitting up nice and tall, so noticing the sitting bones of your bottom on your chair and growing out from your sitting bones, lengthening through your spine. And again, that might bring sensations around the area of your operation. See if you can just gently draw your shoulders open if they're forwards. So there's a sense of expansion across your chest. Maybe breathing a nice smile across the front of your chest. Inhaling, lifting your ribs slightly away from your hips. You might notice a slight activity through your spines. As you exhale, bring one ear down to one shoulder. Open and closing your jaw. There's connections coming from your jaw down through your body, fascial connections, soft tissue. So by working through the jaw and the neck, you can help tissues around the ribs, the diaphragm. Just staying with that slow, gradual, soft breath. Equal breathing. There's an invitation here to tilt your head back. You might start to notice different sensations around the side of your neck, up into your scalenes. I'm inviting you to make any movements that feel good for you. So you might like to make some semicircles with your nose. Soften your chin down, release back up. Just exploring and pausing anywhere that feels good for you to pause. You might like to open out slightly. You might start to notice sensations lower down the body. If you lean slightly forwards. Really feeling out with your breath and pausing anywhere that feels nice for you to pause. We're looking to keep some sense of pliability in our tissues, but moving in a very kind, gentle, considered and conscious way. Remembering that to reduce your range of movement if there's a sense of pain. So we might notice sensations of mild broadening. That's okay, but any pain, any sharpness, I'll just invite you to reduce your range and just come back to your breath. So inhale, lengthen, exhale, right ear to right shoulder, and just noticing the sensations between your ear and your shoulder on that side. Begin to open and close your jaw. Offer to take your head slightly further backwards. And come back to that soft, slow, gradual, yet deep, full breath. Looking to avoid excess movement through the chest, upper chest and shoulders. So the movement of the breath is aiming to come from a deeper place, the lower part of your lungs, your belly. breathing from the inside out, then you can perhaps start to turn to look down to the ground, almost drawing a semicircle with your nose. And just moving in any way that feels good for you to move, with a sense of release. There's an invitation to maybe move a little bit to the side and forward. You might start to notice sensation further down the body and still in the neck, where everything is linked, everything is connected. So more to the side of the body. And very gently, mindfully come back up to centre. And then just turning to look over one shoulder. Gently moving the head to centre and across to the opposite shoulder. We're going to move into the exercises that are recommended to do following the removal of lymph nodes. So I've had a full axillary clearance, so that's a lot of nodes removed. Some people might have one. These exercises are recommended for everybody. So it's really important that you listen to your bodies and don't follow my range of movement, because we're all going to be in a different place. The invitation here is to make your movements as small as you can to start with, and then slowly and gradually increase your range of movement if it feels right for you to do so. So I'm starting by bringing my ears up to my shoulder about 1 centimetre, and then gently allowing them to relax down. Inhaling as I move them up, that full breath. Exhaling as they gently move back down, and that felt okay, so I'm going to increase a little bit. So starting with reduced range of movement, and if it feels okay, inhale. And exhaling, and if it feels there's a bit of mild discomfort, then I would stay with that range, and with your breath you might feel that discomfort move, and then you access a slightly deeper range of movement. So really tuning in with deep consideration with your breath and noticing how that can find some space for you to be able to move. So there's a sense of linking breath to movement. And that again brings more healing power to the movement practice. Inhaling. It's almost like you're leading with your breath, and then your movement's following your breath, inhaling. Now I can find a nerve there. So I'm going to simply be with it. Allow it. Not resist it. Maybe know that that was my limit for that range of movement. So your nerves are going to be adjusting and adapting to the removal of the tissue. Using your breath to ease into this movement. One more time, inhaling and gently drawing up, slowly, mindfully, using your breath to ease through any areas that might be causing a little bit of restriction or discomfort. There's no tugging or pulling, but there's a sense of moving through. Just maintaining a bit of pliability, seeking out, exhaling and slowly lowering down. So from there, inhale and gently move your shoulders away from each other. And as you exhale, circle them gently up, forwards and down. So again, begin with really small movements. You can always make your movements bigger. Just feeling out what's happening in a micro movement manner, and building up from there, knowing that movement is healing, nourishing, renewing, but also remembering that our body is in the very early stages of knitting together. So we need to move with the utmost respect. So moving now the opposite direction, so the shoulders come forwards and then up. Be with your breath. Start with small circles. So you can maybe have a sense of the breath moving the abdomen and the ribs as you roll your shoulders gently. Less is more at this early stage of recovery. You might need to remove your pillow from underneath your armpit for these next movement exercises. So you're going to bring your hands onto your shoulders. Inhale the points of your elbows forward and up. Keep a lift and a length through your spine. You can be active through the centre of your spine as we lift it up. Again, find that breath around the ribs. Exhale and lower down. So looking to avoid an over breath or an excess movement in the upper body. The elbows are moving up, but the breath is moving out. Exhaling down, starting again with very small movements, feeling into it. It might be that it's enough for you to bring them just a little bit up today. Maybe you can bring them up level to your shoulders. In this early stage, we're not going to be on shoulder height. But once the elbows are up to where it feels comfortable for you, I'll just invite you to consider where your breath's going again. Breathing from the inside out, deep within your belly or in the centre of your ribs. Exhaling and lowering. Inhaling, so you're leading with your breath, you're following with your body and observing with your mind. Very conscious movements. One more time with the elbows coming forwards and down. And the shoulders gently moving away from each other. So there's a sense of expansion across your chests. And just feeling out the breath. And then on your next in-breath, the elbows gently move out to the side. And again, start with very small movements, exhaling down. Inhaling up and exhaling down. Inhale up. Exhale down. So if that feels comfortable, the invitation is to come slightly higher. The elbows can come again up to shoulder height. Maybe keeping the arms to where they are comfortably coming up for you. There's no competition here. And then breathing around the ribs. Again, just noticing sensations. If you find a shooting pain or almost like a sense of lightning down the back of your upper arm or under your armpit, just knowing that that is your nervous system adapting to the tissues that have been removed, almost finding new neural pathways and seeing if you can allow your breath to allow the sensations to pass with your breath. Slowly bringing the elbows back down. So releasing your arms down by your sides. If you had surgery on one side, bring the opposite hand behind your back. So this is called back scratching in your NHS handout. Depending upon the range of movement you had before your surgery will depend on your capacity to bring this arm behind your back. Some people would find this very challenging before surgery. So I invite you to bring your palm to face behind you. So your thumb turns down. And maybe even bring your hand just onto the chair behind you if you're finding that challenging. And if not, you can slide your hand behind your back and find the elbow of your opposite hand. And just notice what range of movement you have in the arm that hasn't had surgery on, because that will give you some information as to what you might be able to, where you might be able to go on the other side that has been operated on. Okay, so I'm obviously used to bringing my hands into a reverse prayer position. So I'm bringing my arm up in between my shoulder blades. If that's available for you, feel free to do so. However, you have the option of bringing your hand just onto your elbow, or it might be enough for you to simply bring your hand behind your back now, just noticing how that opens through your chest, and then gently bring that arm by your side or onto your lats. Now repeating with the opposite side, taking care, knowing that it's going to feel different, and just exploring what's available for you right now in this moment. Not what was there yesterday or what might be there tomorrow, but what's available for you right now. So start by spinning your thumb down and bringing your palm to face backwards first. And maybe just bring your arm back and noticing what happens there, and it might help you to build some trust. It's okay to bring your arm back a little bit, and then bending your elbow. And first of all, just bring the hand onto the hip of that side and see if you can slowly bring the arm behind. Maybe you can reach or pull out. So I've got my cardigan here, you can reach your cardigan, maybe you can reach your elbow. So just very gently moving mindfully. And that might be enough for you today, or you might be able to start to creep your hand slightly up towards your shoulder blades. And it might be you use your opposite hand to encourage that. But again, moving mindfully, knowing that we're all at different starting points here, and whatever you're doing now is helping. Even the breath is helping. So really taking some encouragement from that. Again, it's going to feel normal to feel a little bit of a sensation around the area that the operation was on, and that's okay. Okay, come back to your breath. So we're allowing the breath to move through the area of the operation as well as the rest of the body. So starting to have a sense of systemic healing, healing the whole, trusting the body to heal. It's got an innate capacity to heal. So really our job is to simply allow that process to happen. The body knows what to do, and we're giving our bodies the best chance of doing what it innately knows. It's almost like we're stepping back, creating the space for our body to heal. And very slowly bring that arm back down. And you can keep the arm slightly into you to offer some support if you are feeling a little bit vulnerable. So just keeping a slight pressure of the hand on the leg all the way back down, and then just taking a moment to observe how you're feeling after that movement. And from there, I'm inviting you to bring your hands back up onto your shoulders. So there's an exercise that's given to do, bringing the arms behind your back. So again, just moving slowly with your awareness, bringing your hands up, interlacing them behind your head, but keeping the elbows forwards. And again, you might start to notice, especially if you've had a full axillary clearance, sort of shooting pains down the back of the arm. You might not, but just knowing that can happen, and just to allow it to pass with your breath. Okay, so there's no pain here at the site of the incisions. That's important that we're not, but there is a sense of movement and creating space, perhaps a little bit of mild stretching. So from here now, lifting out your ribs away from your hips, and then bringing your elbows very gently back. And again, you might find your range of movement is quite small at the moment. Maybe you can start to open your elbows a little bit further. And if you find a point of restriction, then just staying there with your breath. So just remembering everything passes. This too will pass. So there's perhaps a little bit of sensation, but with no pain. Gently bring the elbows forwards again. So it might feel for you that you want to just bring the arms back a little bit and then come forward. So always starting with a smaller range of movement. And then easing into it, and if it feels okay, start to open out. You might like to bring your hands a little bit further down. And there's an opportunity here for a full inhalation and expansion through the front of the body. So again, working with your own comfort range, I invite you to soften your shoulders down your back, and as you breathe in, really filling your body with that newness of breath, that new life, revitalizing all of the cells in your body, bringing in healing energy, renewing energy. You know, every day brings with it a new beginning. So really this is just a start for us. Really trusting that. Slowly releasing. Gently bring the arms back down by your sides. Okay, it's really important that you miss out any exercises that don't feel right for you. That one might not be right for some people, I don't think, on their first day. So really knowing that you can come back to that in a few days' time. So just one more that isn't in the book that I think is nice just to release through the centre of your spine is to draw your navel in, round through your back as you exhale. Almost think of emptying through your breath. And as you inhale, lengthen your spine again. So this can be really nice if you've been lying in bed a lot, haven't been moving so much, just to stretch out through the back body and draw in through the front body. It's almost like you're sandwiching the front and the back of your spines together, but there's an opening here, an opportunity to expand through the back of the body. So again, this is almost replicating a little bit like child's pose or a fetal position. It can be really nice to stretch out through the erector spinae muscles. So it might be you can come into an all fours position on your forearms. I've been doing that in bed and doing this kind of movement just to release through the lower back. One more time, exhaling. It's almost like you're creating a space at the front of your body, hollowing in, but still supporting with your hands on your knees or your thighs. And you're linking breath to movement. Inhaling and gently come back up to centre. And then rolling the shoulders, just small micro movements again. With your breath inhaling up, exhaling down. And reversing, coming round in the opposite direction. And gently bringing your shoulders up towards your ears as you breathe in. Exhaling as you breathe out. On your own rhythm, linking breath to movement. Becoming aware of the natural rhythm of your breath, the natural rhythm of your body, rhythm of your heartbeat. When you're resting, I invite you to come back to this slow, soft, gradual breath, equal length inhalations and exhalations. Slowing your breath down really helps you to reset your nervous system, to bring balance back to your body, to bring you into the parasympathetic nervous system, which allows healing to take place. It might be that you gradually allow your exhale to lengthen. If it's comfortable for you to lightly close your eyes, please feel free to do so. letting go now of any shaping of the breath and just allowing it to be soft and natural. Taking this opportunity to explore how your bodies and minds are feeling after that movement practice. Maybe you overcame some fear of moving. Maybe it felt quite sore. Maybe you have more range of movement than you thought you would. Whatever's true for you, just sit with that knowledge. It's given you information that you can use to help yourself in your healing journey. If it feels right for you to do so, then just repeat the words in your mind's eye. I trust my body to heal fully and wholly. I trust my body to heal fully and wholly. I trust my body to heal fully and wholly. Bringing your hands to your heart centers. And just taking this moment to connect with your heart centers. Maybe you can visualize love hearts pouring out of your heart center. Maybe a colour comes to your mind, just allowing that if it does, and doesn't matter if it doesn't. And then bringing that love and that kindness to the area of your operation. Visualizing the love hearts pouring out, knowing that love heals all. Replacing any inner resistance with love, with kindness, with acceptance, with compassion. Taking this moment to thank yourselves for being so brave along this journey. And taking this moment to thank your amazing bodies for their capacity to heal. Showing us what we need to learn and to know. Just acknowledging that we are in a relationship with our bodies. Helping each other, supporting each other. It's quite a nice empowering quote I like. Accept what is, let go of what was, and have faith in what will be. Wishing you all the very best on your own healing journey, from sending you all the love and light into the depth of your beings.